Hi, my name is Victoria and I'm a student nurse practitioner. And what is your name?
Valerie.
Nice to meet you, Valerie. And then how old are you?
I'm 52 years old.
Okay, and then what are you here for?
An annual checkup.
Okay, so we'll do like a preventative screening on you. And then we did get her vital signs and they were all within normal limits. And then, so I'll start off with asking a few questions. Is there any medications you're taking?
Insulin and pantoprazole and levothyroxine.
Okay, for all of those, for the insulin, what's the name of the insulin?
Lispro.
Okay, and then how often do you take each medication and then what dosages?
Insulin is through my pump, so it's steadily delivered. And my levothyroxine is 200 mcgs and my pantoprazole is 40 milligrams.
Okay, and then how often do you take the medication?
I take them every morning.
Okay, and then do you take any other type of insulin or just the continuous one?
Just the continuous one.
Okay, and then do you have any allergies to anything?
Ozempic.
Okay, and then what's your reaction to Ozempic?
I get extremely nauseated. So.
And then have you had any surgeries?
I had a total hysterectomy in 2014.
Okay.
And I've had 2 C-sections in 2004 and 1996.
Okay, and then any other surgeries?
No.
Okay, and then what is, for your personal self, what is your medical history?
I have a history of diabetes and thyroid problems. Nothing else.
Okay. For the omeprazole, what do you take that for?
Acid reflux.
Okay, so that too. And then what about for your family? Any family history of anything like cancer, heart problems, arthritis, anything like that?
Mom and dad both had heart disease, and I had one aunt with breast cancer.
Okay. And then if you remember the ages of anyone with all those that they were diagnosed, what would be the ages of them?
When they were diagnosed?
Yep, sorry, when they were diagnosed.
I unfortunately don't remember.
Okay, and then how old were they when they were deceased for whoever, if, I should ask, is anyone alive still?
My aunt with breast cancer is still alive. Both my parents are deceased. Mom died at 76, dad died at 85.
Okay, and then how old is your aunt?
She is 82.
82. Okay, and then is it your aunt, sorry, I can't remember if you asked me, if you told me from your mom's or your
My dad's side.
Your dad's side, okay.
Maternal aunt.
And then, okay, so we got your surgery, allergies, and then have you had any mammograms done?
Yes, last one was 2 years ago.
Okay.
I don't remember the exact date.
That's okay, 2 years ago. Do you know what the diagnosis was, the result of that?
Everything was clear.
Okay, and then have you had any colonoscopies done?
5 years ago.
Okay.
All negative.
Okay, good. Have you had a hysterectomy, so you haven't had any recent pap smears, correct?
No, I'm no longer needing pap smears.
Okay. Do you remember the last time you had a period?
Would have been
Was in
October of 2014.
Okay, so that, and then let's see. Sorry, just making sure I asked you all the questions. Any recent lab work that you've had?
A couple months ago.
Okay, and then how were the results on that?
Everything was good.
Okay, and then did they check your hemoglobin A1C for your
Yep,
blood?
that was 5.1.
Okay, so got that controlled, managed. Have you had any like DEXA scan done?
No.
Anything like that? Any worries previously from any other providers
No.
regarding? Nope. Okay, good. And then, do you smoke?
No.
Do you chew tobacco? Anything like no tobacco products?
No.
Any illegal drugs that you use or used?
No. Excuse me. Bless you. Excuse me. Sorry.
You're good.
No, I don't. I do not smoke or chew.
Okay. And then, do you drink alcohol?
No, haven't drank for 13 years.
Okay, good. Congratulations. It's really good. And then, who do you live with?
Significant other.
Okay. And then anyone else that you live with?
No.
And do you live in like a safe neighborhood, you feel like?
Yes.
Okay, no fear of anything happening?
No.
Okay. And then do you wear a seatbelt?
Occasionally.
So it's important to wear a seatbelt?
Yes, it is.
So make sure you start wearing that just because you don't want to get any injury, especially, you know, with some of the drivers that we have around town.
Mm-hmm.
And then where do you work?
At a clinic.
Okay, and then What do you do at the clinic?
I'm CNA.
Okay, and then is there any environmental exposures that you're, like anything you're exposed to that you have fear of chemicals or anything like that?
No.
Oh, okay. And then, do you exercise?
Occasionally.
Okay. How often, like in a week, how often do you exercise?
Probably once a week.
Once a week?
Just walking my animals.
Okay. Do you live with some animals?
Yes, I live with 2 dogs and 1 cat. They're all mixed breeds.
Okay, perfect. And then any reaction to that allergen wise?
No.
Okay. And then let's see. What about eye exam? When's the last time you had an eye exam?
2 months ago, everything was good.
Okay, did they do that Snellen eye chart on you? Like
Yes.
check your vision? That was like 20/20 normal or anything?
I wear corrective lenses.
Okay, with the lenses, is it 20/20 vision?
Yes.
Okay, and then what about dentist exam?
A couple months ago.
Okay, did everything look good there? Any cavities?
Yes. No, everything was good.
Okay, that's good. And then I'm just gonna go ahead and assess you. I just wanna make sure I got, let's see, all the questions asked real quick. Since you're diabetic, have you had any issues with like sensation to your feet? Have you noticed anything? Any,
No.
any wounds that take longer? Do you have any concerns?
No.
No? Okay.
Everything's been good.
Alrighty, and then, oh yeah, I'm gonna ask, how has your like smell been? Like, are you okay with smell? Any
Yes.
loss of smell? Any taste? Concerns hearing? Concerns any vision with like floaters, anything like that?
No.
Okay, perfect. So, what I'll first do is I'm gonna like feel your face and make sure like you can feel this. Does that feel okay?
Yes.
Okay, and I'm just gonna assess your lymph nodes. That's good. And then does that feel okay?
Mhm.
Okay, and then I'll check your scalp real quick. Looks all good. Oh yeah, I was gonna ask you, do you drink caffeine?
Rarely.
Rarely? Okay, how often do you drink caffeine? A week?
Maybe once a week.
Okay, just like 1 glass of,
Yeah.
is it coffee or something else?
It's usually an energy drink once a week.
Okay, perfect. And then I'm just gonna feel your pulses here, make sure that's okay. Very good, and then I'll have you squeeze my fingers, assess your strength. Very good, good even grip. And then, let's see, eyes look good. I'm gonna examine your eyes. And then first I'm gonna check for perla. I'm gonna make sure this is not too bright. So just straight ahead. Good. Pupils are equal, round, reactive to light. And then what I'm gonna do is I'm gonna have you follow my finger. We're just checking your oculomotor, optic, different that. Very good. And then another thing I'm gonna do is I'm gonna put a fingers, like different number of fingers by your eyes, and then just stare straight ahead and see if you can see what they are.
2.
Okay.
3.
Very good. All right. Oh yeah, and I'm gonna do a whisper test too, like to see how well you hear me. Okay.
Okay.
So I'm gonna say 3 different words, and then just let me know what they are. Okay.
Okay.
Cat, dog, red.
Cat, dog, red.
Very good. And then I'll just do that to the other side here.
Blue truck, green.
Very good. Okay. I'm just gonna listen to your heart here soon, and then I'll just have you also puff out your cheeks. Very good. And then raise your eyebrows. Very good. And then, since I'm actually up, I'm gonna assess your hearing as well and make sure, and then we'll look at your mouth afterwards, okay?
Okay.
So this is the Weber test. So just let me know if it's equal to both sides.
Equal.
Okay, still equal, so good?
Yeah.
Okay, and then I'm gonna do that to each side, okay, of your ears.
Okay.
The Rhine test is what it's called. Sorry, give me 1 sec to do that again. I need to see my watch. Okay, so let me know when you stop hearing that.
Now.
Okay, and then let me know again when you stop hearing that.
Now.
Okay, very good. I'm gonna do the same thing on this side. Just gonna move your hair out of the way here. Okay, let me know when you stop hearing that.
No.
Okay, and then, oh, sorry, again.
No.
Okay, very good. I'm just gonna inspect your nose area and make sure there's everything okay. Is it okay if I
Mm-hmm.
do? Very good. Looks medial. Don't see any lesions. And then I'll have you open your mouth and I'm just gonna inspect. And then just say ah. Very good. Uvula is midline, good. And then tonsils bilateral equally. Doesn't look like you have any inflammation going on. And then I'm gonna inspect your ears and then let me know if anything hurts, okay?
Mm-hmm.
Very good. Your ears are clean. Nice and clean. I don't see any wax in them. Nice and pearly gray. And then also nice and pearly gray. And no wax. Looks good. And then I'm gonna have you smell this and just let me know what you smell.
Peppermint.
Yep, that's correct. Good. Just wanna make sure your smell is good. And then I'll have you close your eyes. And then I'm gonna just put some soft and sharp objects. And then just let me know what you feel, okay?
Okay. Sharp. Sharp.
Okay.
Soft. Soft. Sharp. Soft.
Very good. And I'll just do that on your legs. Normally we'd expose the skin, but we're just gonna do it on you. And again, same thing.
Sharp. Sharp. Sharp.
Yeah, I'll do it again.
Soft.
Okay, and again.
Soft.
Very good. Okay, and then you can just relax for this part. I'm gonna listen to your heart. And then normally I would have you take your shirt off to inspect like direct skin, but for the purposes of the video, we'll defer you taking your shirt off and then defer the pelvic exam as well, okay? Rectal pelvic exam. So yeah, you can just breathe normal. Very good. So heart sounds normal, no murmurs, no gallops. You have the normal, the S1, S2. And then what I'm gonna do is I'm gonna listen to your lungs on both sides, okay?
Okay.
So let's just start from here. So take a deep breath. Good. And kind of just do that throughout here. Okay. Very good. Again. Good. And then one more time here. Doing okay? Okay. Let me know if you need a break, okay? And then again. Very good. Again. 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 And then just one more time here. Very good. And then what I'm gonna do since I'm back here is I'm gonna have you say 99 as I'm listening to your lungs, okay?
Okay.
Okay, so say 99.
99.
Very good.
99.
Good.
99.
Good.
99.
Good.
99.
Good.
99.
Okay, very good. That sounds normal. And then I will, let's see, do the same thing, and then I'll have you kind of, yeah, let me have you lean in just so it's a little more comfortable for you. That way you're more relaxed. If you want to relax against it, you can. I know sometimes sitting up is a little challenging. I'm just gonna move this a little bit out of the way. Okay, say 99.
99.
Very good.
99.
Good.
99.
Okay, good. And then also, since you're there, I'm just gonna feel your pulses. Very good. Good, no bradycardia, tachycardia, it's regular, right in rhythm. And then I'll have you sit up real quick just because I'm gonna lean you over, but I don't want you like falling down. For this part of it. Okay. I'm just gonna lift this up and I'll have you lay down, okay? Does that feel okay like
Yep.
that?
That's fine.
Okay, so I put her at a 30-degree angle and checking for any jugular venous distension, so that looks good. And then next what I'm gonna do is I'm gonna listen to your abdomen, and then also just for video purposes, we'll keep your shirt on. We won't move anything. And then do you have any issues with like either diarrhea, constipation, any chills, fever, nausea, anything like that?
No.
Okay. It's right here. Okay. Sounded very good. I'm just gonna palpate it here, and then let me know if anything hurts, okay?
Okay.
Oh, that feels okay?
Yep, everything felt good.
And then what I'm gonna do is I'm gonna palpate for your liver, okay? So you're good, just relax. I'm gonna start here. Sorry, I'm kind of hovering over here. That's your liver, the different sound it makes. I'll start here, do the same thing. Okay, feeling like for your liver border, making sure it's not enlarged. And then what I'm gonna do is I'm gonna check for your kidneys, which those are usually hard to feel. I'm gonna inspect for that. And then I will do the same here on this other side. Good. And then also we'll inspect the palpate for the spleen, which that's also hard to palpate. And then any bladder issues, any like emergency urination, nothing like that?
No.
Okay. And then I would normally assess the skin as well, like see if there was any scarring, any lesions, incisions, any infections shown anywhere on the stomach. Hands are nice. Both of these capillary refill are like less than 2 seconds. So I'll have you go ahead and sit up here, and then inspect it. I'm just gonna inspect for some edema, any fluid in your legs to see if you have any. As well, I'm just gonna lift your pants up here. Okay, very good. No swelling, skin dry and warm. Also no lesions, incisions, any wounds that I see. And then since you're diabetic, I'm gonna check your feet, okay, just to make sure they're okay. Is that fine with you?
Yep.
Okay. And I'm also gonna assess your pulse, your pedal pulses. Very good. Sorry.
Oops.
Ticklish. Good. Very good. And then do you go to anyone for foot care, or do you do that yourself?
I do it myself.
Okay. Any problems with that? Is that okay?
Yeah, it's good.
Yeah. Okay, very good. Also circulation good. Is that fine?
Yep.
Good. Okay, perfect. And then I'll have you shrug your shoulders too, just to assess. And then I'll actually here. Let me. There you go. I was like, where do we have it? Yes. There you go. I'll have you shrug your shoulders. Make sure that feels good. Okay. Very good. And then push up against my hands. Very good. And then down. Very good. And then next what I'm gonna do is I'm gonna have you walk. I'm just gonna move this chair so I have some room. And just walk like straight this way, like real quick. I just wanna make sure your gait is okay. Looks normal, no issues with that I can tell. And then you're perfect, alert oriented to everything. Do you know what the month is?
July.
Okay, perfect. And then do you know where we're at?
Williston, North Dakota.
Okay, good. Right there. And then yep, you know your vowel. It's just making sure you're oriented. And then have you ever done a depression or anxiety screening?
Yes.
Okay, and then how recently, and then what were the results?
Before this appointment, and all negative, all zeros.
Okay, yep, and then our front desk had reviewed all that, got the paperwork, yep, And then I did look to that, just wanted to kind of get on verbally from you. And then I will kind of just go over real quick with you the kind of preventative stuff. So it's important to get a mammogram every 2 years for that, and then colonoscopy, just get that every 10 years. Make sure you do that. Wear your seatbelt. You're not at risk of osteoporosis from family history wise, so you don't have to do a DEXA scan at the moment, so everything looks good, but you can like do preventative of like taking calcium and vitamin D, and then for joint support you can also take some glucosamine as well. And then you just had labs recently, so we don't have to repeat your annual labs until the follow-up, since you just had those recently. The eye exam, just do that every 1 to 2 years, and then dentist every 6 to 12 months, kind of depending on what your dentist says, if there's any changes, okay?
Okay.
And then do you have any questions?
No.
Okay, well thank you so much for letting me examine you.
Thank you.
Yep, and we'll see you in a year.
Thank
or
you.
sooner if needed.
Okay.